Hello everyone, my name is Hadeel Shihan. I'm a third-year pediatric resident at Children's Hospital of Michigan, and today I'm going to present to you our study titled Minor Head Injury Transfers to Academic Pediatric Emergency Department, Trends and Outcomes. This is the list of the authors who contributed to this study. The idea behind this research was the observation that traumatic brain injury was a common reason for transferring pediatric patients from a community emergency department to a pediatric emergency department. Furthermore, we did observe that minor head injury, which we identified as a Glasgow Coma scale of 14 or more, did compose a significant proportion of these transfers. This observation was noticeable despite the publication of PCARN study in 2009, which had clear guidelines about the disposition and neuroimaging indications in minor head injury. Our objectives were summed up in 3 objectives. First of all, we wanted to describe the outcome of these transfers, whether an intervention was needed or it yielded in discharge. Secondly, we wanted to observe the trend of these transfers from 2013 till 2018, which was the study period. And finally, we wanted to compare the CT utilization rates for minor head injury between the 2 types of the emergency department, meaning community emergency department versus pediatric emergency department. That's why a retrospective chart review was performed on the charts of the patients or the children aged less than 18 who were transferred for minor head injury to our emergency department. And it was during the study period, which we said previously was between 2013 and 2018. We did review the demographics, the severity of the mechanism of the injury, the risk stratification of the head injury based on PCARN criteria, and the CT utilization as well. Also, the interventions and the final disposition of the patient were reported. Subsequently, descriptive analysis was conducted after being done with the data collection. 1,078 patients were included. Majority of them were males and more than 2 years of age. In our study, we did observe that there is a gradual decrease of the number of transfers throughout the years. As you can see, around 1/4 of the patients were transferred in 2013. However, only half of this patient was transferred in 2018. Despite that decrease, CT utilization rate remained high throughout the years. And you can conclude that the CT utilization rate was higher in the community emergency department for the intermediate risk and the low risk patients compared to the pediatric emergency department. And the intermediate risk and the low risk were identified according to PCARN criteria, which indicates the risk for a clinically important traumatic brain injury. A closer attention was given to report the interventions that were done for the children at the pediatric emergency department to see if there is any way to avoid these transfers, if these interventions can be given in the outside emergency department. You can see that around 2/3 of the children did receive an intervention. However, it was mostly subspecialty consult. Around 85.8% required a subspecialty consult, meaning neurosurgical evaluation in the emergency department, and it was followed by neuroimaging. Around 41% required neuroimaging, and 1/5 of the patients required IV hydration. Minimal percentage of the patient required IV seizure medications or trauma code activation. The final disposition of the patient was one of the vital objectives in our study, and you can see around 2/3 of the patient did go home. Around less than 1/3 of them required an admission for observation or full admission. Less than 1% did require surgical intervention and they went immediately to the operating room, and less than 3% required an ICU admission. Our study results were consistent with the previous studies. As you can see, there is a retrospective study done in 2019, which reported around 42% of the transfers to a pediatric trauma center were potentially avoidable, and also minor head injury was reported to be a common presentation of the avoidable transfers. Another study wanted to study the trends of obtaining CT from 2007 till 2015 to see if there is a difference between the time before PCARN criteria were published and after the PCARN criteria were published, and it concluded that the rate of CT utilization did not decrease. In conclusion, the majority of pediatric minor head injury transfers were discharged home following a subspecialty consultation with or without neuroimaging, and despite the guidelines and low incidence of clinically important traumatic brain injury, CT utilization remains high, especially in the intermediate and low-risk minor head injuries, and as we reported previously, it was higher in the community setting, which indicates that there is a potential way of improvement in that perspective. These are our references. Thanks for listening.